we need to be ready because we're probably going to see an increase in spike of emergency visits coming to the hospital and increased number of patients actually being admitted, which is exactly what I saw during my time was all these patients being admitted on that Friday because of wildfire smoke.
Dr. Bhavini Gohel knows when it's a dangerously smoky day in Calgary, and not just because she feels it in her throat, but because of the number of patients she sees in emergency. Older adults are among those most at risk, and with climate change driving longer and more intense wildfire seasons, many of us are spending more time exposed to the smoke than ever before.
The smoke isn't benign. It's very dangerous. And I know a lot of people don't realize how dangerous it is. And it's really important that I think we need to make sure that we're preparing ourselves now for every annual wildfire event that we're seeing.
Now, new research is revealing that the tiny particles found in wildfire smoke can travel into the bloodstream and even reach the brain, triggering inflammation that may contribute to cognitive decline.
But it is a risk factor. So it's going to increase your risk of developing Alzheimer's dementia. So if you're at risk and then you're constantly in wildfire smoke, we know that's going to trigger and probably make you more likely to develop dementia.
Why are older adults at greater risk than younger people when it comes to wildfire smoke?
What we're actually seeing, and I'll sort of go back to sort of the effects that we're seeing, the sort of the science behind the smoke. So we know that the wildfires release a particulate matter called PM2.5. And that PM2.5 you can either inhale through the nose, and it goes through the nerve into the brain, or you can actually breathe it in, and then it gets into the bloodstream and crosses the blood-brain barrier. What happens then in the brain is that you get this kind of stress response that happens in the brain when these particulate matter crosses that blood-brain barrier, and that stress response creates these harmful molecules. And those harmful molecules lead to cellular damage and cause inflammation in the brain. And in our adults, we know that their brains are already vulnerable. We see a lot of our older adults, they do have some sort of cognitive decline, whether it's very mild to dementia. And when they already have that sort of cognitive decline and you add that neuroinflammation, it makes them more susceptible to the effects of wildfire smoke more than others.
And wildfire smoke in terms of the effects on their brain, but also their lungs as well?
Yes, and also their lungs. We know that, as you get older, your physiology in your body changes. And of course, the impact when they breathe in that smoke is much more prominent. So, I was working at the hospital last week when we were dealing with very high and very high and very severe sort of wildfire smoke. And we had a lot of older adults come in that have lung issues, already underlying lung issues like COPD, that were coming in with exacerbations of that because of the wildfire smoke, because they'd been outside and had quite a bit of exposure to the smoke, and that was causing an exacerbation and potential pneumonias as well.
So when do you know when you should go in? Like you said, you had a number of people in emergency. When do you know that you should go?
So for those with lung issues, they should go in when they're starting to have problems with their breathing. So those that have your old adults that have underlying sort of chronic obstructive pulmonary diseases or asthma, and they're finding that they're struggling to breathe and using their inhalers very frequently, they should be going in right away to actually get treatment to actually manage that. And for our older adults, one of the things that we notice with those that have dementia is the confusion. We're only starting to understand that. We know that generally the population during wildfire smoke, they get foggy. You see that cognitive inattention. Headaches tend to happen as well. Now let's add dementia on that. Now you've got dementia. You can only imagine with the wildfire smoke how worse their memories getting. So if we're finding that their memory is getting really bad, they're getting really, really confused, and they're very far off their baseline, those are times where they should be seeking medical attention and getting checked by a medical professional.
Now, was this all relatively new research? Because, I mean, we always kind of focused on the lungs when it came to wildfire smoke. And, I mean, people talked about headaches as well. But what have we learned in recent years about its effect on the brain?
We are only starting to understand this. And this is why we actually formed the Brain Climate Equity Collaborative, because we were never talking about the effects on the brain until recently. And now the research is coming out. More recently, an actual paper showed that the number of visits to emergency increased by 6% for migraines. And that was a study that a Canadian study that they did. So we're really only starting to understand the brain effects. So for Alzheimer's disease, we know that now air pollution is a risk factor. It's actually much higher than people think it is for dementia and for developing Alzheimer's disease. And so it's all very new and relatively new research, because a lot of the work has been done, a lot of the studies have been done in sort of the initially the animals, and now we're starting to understand this and sort of look at this from the human impact.
What actually, if you can put it in simple terms, what is happening to our brains when we're outside on a smoky day?
What we're seeing is that we're like I said, sort of what we're seeing is that we're breathing in that particulate matter, and then your brain is seeing that as like a foreign body, right? They're
Right.
very tiny, tiny particles. It's seeing it as foreign, and then of course is sort of using its response to basically attack it. But then it's creating these harmful substances, and then that's leading to that inflammation and then a change. And when you get inflammation, you get a change in that blood flow as well in the brain.
Can the smoke also affect your mood or anxiety or your sleep, things like that?
Yeah, and so I've heard a lot of people actually say it's been affecting their sleep. And again, hard to know exactly what the physiology behind that. Some of this could also be related to, people experiencing headaches, difficult sleeping, breathing issues. But the other thing that we've noticed is the mental health impacts as well. So we know that I think it's 57% of youth have eco-anxiety. So we know during wildfire smokes, the mental health impacts actually increase. You actually see that anxiety, especially for those that have been through that traumatic experience of having been evacuated during wildfire smoke as well. So we know the mental health impacts are there. The other thing that I should also mention is that there was a Canadian study done that looked at the relationship of wildfire smoke and cancers. So we're actually starting to understand a connection between wildfire smoke and cancers as well. And we think there is a relationship there as well. So what we've been very articulate about is that it is a risk factor. So it's an added risk factor already to others, but it is a risk factor. So it's going to increase your risk of developing Alzheimer's dementia. So if you're at risk and then you're constantly in wildfire smoke, we know that's going to trigger and probably make you more likely to develop dementia.
Do we know if the damage is reversible?
So we know with dementia right now that it's not reversible. But in terms of the general effects that people are feeling, the neuroinflammation will calm down, once you've sort of, as inflammation does, right? It will calm down, but obviously repeated exposure over and over and over and over again is going to have some sort of impact on the brain.
How about on the lungs? Is it reversible there? Like, I hear with
Um,
smoking that lungs
yeah,
can heal
yeah.
themselves to some extent.
Well, it's again, there is some studies now that are saying that we know that wildfire smoke leads to issues with brain development, as well as lung development as well. So if you're having repeated exposure to smoke constantly, then that is going to damage the lungs. And we've seen this in parts of rural India where I've worked in the past, where I've worked in a rural village and they've got pollution coming close to them from Delhi, along with brick making factory releasing particulate matters in their cooking practices. That repeated exposure has led to 20-year-old women that are now developing chronic obstructive lung disease. So you can imagine if you're living in a part where you're constantly being exposed to wildfire smoke, it's like smoking cigarettes. Of course, your lungs are going to be harmed and affected by it. And we've seen this in other parts of the world as well, where pollution does have an impact on the lungs. It's a bit like smoking, I kind of use the analogy when you smoke cigarettes
Mhm.
and you smoke cigarettes and all of a sudden you stop, there is going to be some damage. You can't reverse that damage. It's going to be very difficult. You just stop that lung getting any worse. And that's exactly the same thing with wildfire smoke and other smoke and air pollution. Like you have that initial damage, and then you're not going to be able to reverse that initial damage, but you are going to be able to, like, you're going to stop the progression of your lungs actually getting worse. So it's the same thing with cigarette smoking as well.
What can older adults do to protect themselves?
So there's a few things, staying indoors, of course, but that can be very, very difficult. N95 masks are key. They actually reduce your exposure by 95 to 98%.
Mhm.
I've seen a lot of people use the cloth masks, and they don't protect you from the fine particulate matter. You need the N95 masks. And it's really funny because some people say to me, well, how quickly do you develop headaches? And some people are developing headaches within like 10, 15 minutes of being outside because the air quality is so severe that their body is just getting, it's just getting into that inflammatory response. And so as soon as you come out, getting that N95 is going to be really, really important. The other thing that we're advising and asking people to do is in their homes, we know that your filtration system is very important. So we're recommending, sort of MERV 13, at least MERV 11, but MERV 13 filters. That tends to filter out about 50 to 80% of particulate matters. The issue is always going to be the cost because the higher the filter, the more increase in costs. But during like the smoky days, it's important that you do have that MERV 13 filter. Your doors and windows are actually closed as well, and you sort of minimize the amount of indoor particulate matter. Now, Health Canada, there's some more work coming out about when it's very, very severe because buildings aren't completely leak proof, right? And if you're an old building, you're going to get that leak in. So actually, sometimes wearing, like when it's very severe, wearing those indoor masks, wearing the N95 masks indoors is going to be important as well.
Is there anything in particular that retirement residents and long-term care homes should be doing during these periods of poor air quality?
It's same thing with
Mhm.
filters. Unfortunately, despite advanced, so there's some studies that are coming out that despite advanced HVAC systems, if you look at these facilities, there's still ways that, you're not sealing off the building. There's still ways that that particulate matter can enter through windows, doors that are open. So in actual fact, despite the advanced HVAC systems, there has been studies showing that there is some particulate matters coming in. But either way, these old age homes, these continuing care facilities need to make sure they have advanced HVAC systems in place to filter out as much of that air as they can. And then when they're in open spaces and when there's windows and doors that are open, they need to make sure that they're sort of giving their residents N95 masks to wear, so that they're sort of fully protected as well, which can be very difficult. We recognize that. But um, I think, yeah, just things like ensuring that the HVAC systems are sort of very advanced and do have good air filtration systems is going to be important.
Hmm. Now, wildfire season is clearly affecting more Canadians than it ever has. I mean, I'm sure you can
Mm.
talk to anyone over the age of 40 and they'll tell you they never experienced this as children. How concerned are you about what this means for brain health in the years ahead?
Very concerned. I mean, I didn't grow up in Canada, but when I first came, I didn't sort of see this as an annual event, and it's become an annual event. Um, Canada's warming faster than anywhere else in the world. Um, and our forests are getting drier, which is a fuel for wildfires. So we're very concerned because this now has become an annual event. When I looked on the 26th of July, there were over 800 fires still burning across the country. And it's becoming more and more prominent every year because because the trees, they don't, the roots aren't getting the water that they need, and then they dry, and that's fuel for basically ongoing wildfires because it's just so dry. Because where clearly the globe is warming faster than we had wanted it to. We're not meeting the Paris Climate Agreement at 1.5 degrees. We're going to be surpassing that. So I'm very concerned because we know that brain health is also an economic cost for people as well. Because if you look at the economy impacts of wildfire smoke, you've got a lot of people working outside and it impacts their ability to work. If you've got headaches, migraines, you're going home, you're not productive. So there's a big economic impact. If you've got people developing dementia, more people coming to emergency departments due to due to dementia, due to headaches, migraines, strokes, that also put you at risk. That's adding extra pressure to an already pressurized healthcare system that's struggling and adding more cost to the healthcare system.
What changes then would you like to see in public health messaging about the wildfire smoke?
I think that public health messaging needs to be much, much stronger, much more firm. What I want to see is early warning systems put out, is what I would like to see. I would like to see that alerts are sent out to people's phones, clearly saying that we are in high or severe high air quality, um, and um, and that these are the precautions you need to be taking. And it's not just that. I think that it's not just the public messaging that needs to go out. It needs to go out to healthcare systems that the air quality is very bad, and we need to be ready because we're probably going to see an increase in spike of emergency visits coming to the hospital, and increased number of patients actually being admitted, which is exactly what I saw during my time, was all these patients being admitted on that Friday because of wildfire smoke. So I think that what we need to see from public messaging is that this is now becoming an annual event. There needs to be very strong messaging going out that wildfire smoke is dangerous, and that as soon as we're in that high risk and very high risk, that there's almost like an alert sent out, clearly telling people how they need to protect themselves as well.
And should there be more messaging to make that link between climate change and these health impacts?
Yeah, and we know that the impacts from climate change during extreme heat, 600 people died in BC. We've seen a number of people die in France, and extreme cold as well, wildfire. We need to be seeing more of that messaging go out to the public, and then once the public start making the connection, they're like, oh, we didn't realize. But also that messaging needs to go out to healthcare. I think healthcare is still very, there's still a lot of work that needs to be done in healthcare to get this messaging out about the connection for climate change on health as well, because a lot of that messaging still isn't going out. There's a lot of people that are working in this space that are trying to put into medical education, but it still isn't. It's still right now, if you look at sort of a lot of the clinics and the hospital facilities, there isn't that messaging that's going out to patients that we're advising that, look, their quality is bad, make sure you do X, Y, and Z. So I think that yes, there's got to be some public messaging, but also the healthcare systems also have to step up and make sure that they are actually explaining the impacts of climate change on health.
Mhm. And just to close off here, I mean, you started with saying the seniors are some of the most vulnerable people, but when it comes to the dementia risk, is it fair to say everyone is is being impacted in their brain health by being out in on uh poor air quality days?
Yeah, absolutely. Everyone's affected by the wildfire smoke. I know that I find that I'm a little bit more foggy and my attention isn't good. We know that. We know that everybody is affected by wildfire smoke, whether it's headaches, whether it's inattention, whether it's fogginess. We know that there is an impact, and everyone is absolutely impacted by the wildfire smoke. So the younger generation,
Mhm.
yes, there is some studies that are starting to come out saying that there could be some impacts on the actual brain development. So yes, as you get older, will that generation potentially be at higher risk of dementia potentially? But again, those are studies that we're still sort of trying to, that are still coming out right now and we're working on.
Good grief, just another thing to add to the list of eco anxiety.
Yeah,
Yeah, it's
exactly.
awful. Again, then you
Yeah,
add into that mental health business, right? Because for me, and we always tell people, because I do stories about nature prescriptions and the importance
yeah,
of getting outside, and that's my stress relief is to be outdoors. You take that
yeah,
away from a person, so I have to balance it. Well, I really want to run outside, but I'm not
yeah,
supposed to be. But I'm like, do
yeah,
I say screw it and I'll take the risk of the dementia and keep
yeah,
my mental health at the moment? It's
yeah.
a lot of balancing to take place there.
It is a lot of balancing, and it's really difficult for us to know, like we know certain individuals, if you've had a family history of dementia, you're more at risk, right, of developing dementia. And so when you add the wildfire smoke, it's adding to that risk. Others may be fine, they may have repeated exposure, and they may be okay, and they won't develop, maybe they'll develop mild cognitive impairment, or maybe they won't develop any cognitive impairment. But we know that there are certain individuals that are going to be at higher risk. And it's always hard to know who those high risk individuals are, as well, because, health is an evolving issue, right, for individuals. And different things change in your health. So it's always very hard to make that connection is okay, repeated wildfire smoke in our young, and trying to follow them and see if they develop dementia, what is the likelihood, but how much of that is truly connected to wildfire smoke. And that's where the causation becomes very, very difficult to make, because you physically trying to study that is very difficult to do. So what I would say is that those that are at risk, that have other risk factors, or have family predisposition to dementia, they are slightly at higher risk. But again, it's always hard to know and to make that connection. And I think going back to what you're saying is balancing being outside. Like, you're right, being outside is so important for your mental health. And then you have smoky days, and I mean, being outside in smoky days isn't pleasant. You just want to be indoors anyway, but you've got to balance that up. If you're outside running and you don't have N95, your exercise tolerance is going to come down. You're probably going to really struggle, and you're probably going to feel the effects later on of that run because of the
Mhm.
wildfire smoke. And running in an N95 mask is not pleasant.
Yeah. Well, you pointed out a lot of wonderful information here, very valuable information to us. Is there any one message you would want seniors and their families to remember this wildfire season?
I think that what I would like to would like them to remember is there is a health impact. The smoke isn't benign. It's very dangerous. And I know a lot of people don't realize how dangerous it is. And it's really important that I think we need to make sure that we're preparing ourselves now for every annual wildfire event that we're seeing. And that's making sure your filtration system's updated. You've got N95 masks available as well, to protect themselves. And that's probably the main message I would give.
All right. And where can people purchase them? Is there any supply issues with them? And do you know where? Is it
Um,
just at pharmacies or where can you get
yeah,
N95
I know.
masks?
I know pharmacies. Some pharmacies hold them. Online, you can get N95 masks. Now, there's a thing about being fitted, and that I don't actually know how you get fitted. So, healthcare workers have to be fitted for their N95 mask. But most people, they're sort of a generic couple that people actually use. But and it's all about sort of how it fits around the nose and the mouth. But you can find them in pharmacies, online as well. There's no supply issues right now. I am that I'm aware of. I think there's quite an abundance of them right now.
Okay. And do you have a recommended time or how is it just one use for these or how long can you use one of
Um,
N95?
Typically N95 masks, for healthcare workers are usually sort of one use. So I usually use my N95 for the day because, it gets soaked, and if you're breathing in it, it's so I usually sort of use them one use, which isn't great for the environment.
Mm-hmm.
I know that there are some of these reusable ones that you can use as well, but they're not cheap. And But typically I use them sort of one use. It depends on how long I've actually used it as well. Like, I'm always trying to balance the the recycling and the waste between how much I'm using the N95. So if I've used an N95 the whole day, I will reuse sort of I'll throw that out. But if I've used it for a couple of hours, then I'll sort of use it again later on or the next day. It just depends on how long I've used it. But I'm trying to balance that. So
Of course.
yeah.
Thanks so much. I was wonderful work that you're doing. Thank you so much for the work that you're doing to help Albertans and regardless of their age, stay safe
Yeah.
under these unfortunate circumstances.